Dr. Budoff, what is the triceps tendon?
Triceps tendon inserts right here. It is essentially the only muscle and tendon that helps you extend your elbow.
How is the triceps tendon torn?
Usually torn when you're falling, you put out your hand and the force is too much for the triceps to deal with at that moment for whatever reason, and it tears off the elbow bone.
What happens if you don't repair the triceps tendon?
You really want to repair it. It's the only thing that helps you extend your arm. Otherwise, you won't be able to push. You won't be able to use a crutch or a cane if you get older, and you need those ambulatory aids. If you're falling and your triceps isn't there to help you brace yourself, you'll probably fall right on your face. And it's not like you can wait forever. The body has this use it or lose it quality, and if you don't get it repaired, eventually it dissolves. How long does it take? It takes over 6 weeks to dissolve. I've done them late, but it's a lot tougher. The risk of stiffness definitely increases because the muscle turns to scar and fat, so you get some atrophy there. There are things we can rob from Peter to pay Paul. In other words, take parts from a cadaver to recreate some parts of the triceps if it absorbs or is dissolved by the body. But you really just want to stick with your own body parts if you can, so you want to get it addressed early.
How is the triceps tendon repaired?
It's an outpatient surgery. Put drill holes through the elbow bone and basically put this very strong stitches with a Kevlar core like they use for the bulletproof vests, and that holds it securely. It's outpatient. We splint you an extension for a week or two and then get you moving. Some people don't need that much therapy, some people do need more, but usually motion comes back pretty well, assuming you have it done within a timely amount of time after the injury, and they do really well.
Well, thank you for your time today, Dr. Budoff.
Thank you.